If you're watching this video, that means you already have a surgical drain or you're planning on having surgery that requires having a surgical drain. Now, when we mean a surgical drain, it's this device that is essentially made of a plastic tube that leads to a plastic bulb. How often to empty the drain? We recommend twice a day, usually 8 in the morning, 8 at night, or as often as needed once the actual bulb is about 1/3 full. Once emptied, it's very important to record the output, meaning measuring how much comes out, and specifically make sure you keep track of how much output per 24-hour period. As far as taking care of the drain or emptying it, step one is make sure you wash your hands and the area is clean. You can wear gloves like I am currently, or just make sure you have clean hands. Gloves are not a requirement. I recommend stripping the tubing. So what you do is you grab the tubing from close to where it's exiting the body with one hand, and then with the other hand you pinch the tubing and gently work your way just like this all the way to the actual bulb. The purpose of this is to drive any little clots or any fluid that's stuck in the tubing all the way down to the bulb. That way it keeps the whole drain open and draining. Once you're done stripping or milking the tubing, then the next step is to empty the drain. For this, step one is to open the cap. Step two is you take a measuring cup and you actually empty the fluid into the measuring cup. That way you can write down how much comes out. And step three is to squeeze the bulb all the way, and while keeping it squeezed, placing the cap back on there. That way the drain can continue draining. That's pretty much it on taking care of your JP drain. Now, should you have any questions, feel free to call us or shoot us a message.